Here we have Aziza and Yaprak. Aziza is the CEO and founder of Literaseed. Literaseed is a visual-based communication for doctors to effectively assess patient condition. And Yaprak is the CEO and co-founder of Jolt. It's a marketplace and fan community for over 100,000 games and millions of members around the world. And Aziza, I'll let you take it from here.
Or actually, if Yaprak maybe wants to start.
Oh, sorry.
Yes. I prepared lots of questions for Aziza. So I'll start. Hi, Aziza. I'm very excited about what you're building, and I think you're one of the greatest founders I've ever met. I'd love for you to tell the world about Literaseed and how you got started.
Yeah, thank you, Yaprak. So I'm happy to be here. So yeah, I started Literaseed after a personal tragedy in my family. So I had a 10-year-old cousin who had gone to the ER with a life-threatening condition. She lost her life while waiting to see a doctor. And after I learned about my cousin's death, I tried to make sense of what had happened. I talked to a lot of people who had similar experiences. We have the best healthcare system in the world. I could not understand how a child who was otherwise healthy could get to the ER and not be treated in time for a condition that was highly treatable. This got me thinking, and I started doing some research. I spoke with some doctors and listened to other people's stories and realized that there's some basic essential information that can be communicated between patients or caregivers and their doctors, which can be life-saving. So basically, better communication between my cousin's parents and the medical professionals could have saved her life. And so what we're doing with Literaseed is helping people overcome communication barriers to provide whatever that essential information is to their medical doctors so that doctors can expedite the diagnostic and treatment process for them.
Got it. Okay. Could you tell us how Literaseed is improving that communication barrier between patients and their doctors?
Yeah, so I'd be happy to show you what the product looks like and how it works. I've prepared some slides I'd love to show you. Just give me one moment as I pull that up here.
Yes, please do.
Yeah. So this is a quick run through of our application. We provide a visual interface, plain, simple language. This particular use case is how we're using this with our health system partners for more efficient and effective screening for COVID. So doctors have been telling us that there have been challenges with screening patients for COVID. A lot of patients coming through speak limited English and are passing through the initial checkpoint, being found when they meet their provider that they have symptoms or they have been exposed to COVID. So the initial checkpoint is currently not effective. And our interface is meant to help those patients provide that information, which will make that screening more efficient and effective. So to break it down, here's an example. The patient would access the web application and they would click through the questions such as, do you have a fever? Have you been tested for COVID? There are visuals to help, and the patient will select yes or no. So we're providing an interactive interface that uses a lot of visuals, graphics, and plain, precise English. So for example, the word dizzy can have multiple medical meanings. That does not help a doctor make a diagnosis. So we break it down further to say something like, I feel like the room is spinning around me, to be more precise. So we're providing a set of history questions with visuals and plain, precise language to help people communicate that. And at the end, there is a structured report that is generated that summarizes that information for the medical provider. In this case, helping them with the initial screening for COVID. But the problem we're solving is a lot bigger. It's much bigger than just COVID. So we're a platform across all diseases and use case scenarios. The problem is 78% of misdiagnoses are caused by poor health communication, and they result in 80,000 avoidable hospital deaths every year. Essentially, what Literaseed aims to do is to help bridge that communication gaps for patients to provide essential information that aids the doctor in making those diagnoses in a way that reduce that number.
Wow, that's incredible. So for those of us that are unfamiliar with the healthcare market, could you walk us through how big of an opportunity this is?
Sure. So as you know, the healthcare industry is huge. Literaseed sits within the patient engagement and monitoring sector, which is a $30 billion market. and it's expected to reach 84 billion by 2028. There are 6,200 hospitals that see about 880 million patients each year in the United States alone. Our mission is to lower current costs associated with malpractice and result in better patient satisfaction ratings and save lives while we do it.
Okay, great, thank you. And then also, could you tell us a little bit about your traction today and your user base, as well as other exciting opportunities that you've got going on?
Yeah, absolutely. So we have 2 pilots with 2 major health systems that collectively serve nearly 2 million patients. We have ValueWise in Phoenix and a top 10 healthcare provider in California, with which we are in early conversations. So we've just started some early user testing this week. We are anticipating that because we help providers reduce malpractice claims, which can cost them an average like $5 million to the health system every year, and we are improving patient satisfaction scores, which can determine about 2 to 3% of Medicare reimbursement rates, that there is a significant revenue opportunity.
Wow, yeah, definitely. Okay, so with this fundraise, what are the milestones are you hoping to hit?
Yeah, so at a minimum, we're looking to raise $50,000. This will allow us to do a bare bones launch with ValueWise. And at most, we're hoping to raise about $50,000, which will allow us to have more resources, to bring in more software and product development, client resources that will allow us to go a bit faster. And it'll also allow us to engage with the second healthcare system with greater capacity and to have more impact.
Excellent. Well, thank you so much for your time, Aziza. You're doing such incredible things that's going to have significant impact on the healthcare system, but also save lives. So we wish you the best of luck.
Oh, thank you so much. Thank you for having me. Thanks.
That was so good. Thank you both. Thank you for closing it off really well too. I really appreciate you. Wish I could talk to you longer, but we're gonna have to go to the next one. Thank you so much.
Thank you. Have a great day.